Hi, this is Dr. A, bringing you your next chapter in your Intro to U.S. Healthcare System course, and we are using the 5th edition of the Basics of the U.S. Healthcare System, and we're going to look at healthcare financing. Okay, so this is an overview. This is an intro part, and there's going to be I'm going to have to break this up in multiple videos because healthcare financing is very complex. So we're going to start with an overview. The percentage of the U.S. gross domestic product, or the GDP, that is devoted to healthcare expenditures has increased in recent decades. Also, we are the ones that spend the most in the world as a percentage of GDP on healthcare. The national health expenditures grew 2.7% to $4.3 trillion in 2021. Part of that was attributed to the pandemic, of course, and it's jumped to $12,914 per person, and this accounted for about 18.3% of the GDP. So as a reference, the rest of the world is probably around 9-10% of their GDP. And in the per capita, they're usually below 10,000, but more like maybe 9 to 10,000 or so per capita. So why are healthcare costs increasing, and why are we the most expensive? There's a lot of reasons behind why we're the most expensive, but let's look at why healthcare costs are increasing. So we have an aging population. So unfortunately, the older you are, the more likely you are to need expensive care. And if you have a larger percentage of your population that is in those 60 and above, those higher healthcare cost years, then it's going to increase the overall healthcare cost. So then the pandemic, of course, increased healthcare expenditures because of all the COVID-19 care. So there was an increase in hospital care, and so that increased the overall cost of everything, and how much we spent. And then we also have an increase in innovative care. Lots of new drugs, especially new treatment therapies, have been hitting the market. A lot of those, especially those antibody-based therapies, which often are expensive. There are often injectables. So I'll just pick on Ozempic, just because it's a really popular one and most people know about that one, which is a drug that is marketed for diabetic patients, but also can cause weight loss. And so some people are trying to use it also for non-prescription use, or just to weight loss, even though they're not diabetic. And so that's caused an increase in usage, but these aren't cheap medications. So they're often hundreds, if not thousands of dollars, whereas like the traditional medications, so if you compared a metformin prescription versus an Ozempic prescription, metformin is going to be significantly cheaper, like in $10 or less, or depending on your health insurance coverage, versus hundreds of dollars or more. So yes, innovative care can be effective, but it is costly. So it is also driving the cost of healthcare up. So the increase in federal spending was the result of lost revenue through this provider relief fund. So during the pandemic, the government stepped in to help hospitals survive and providers provide. And also we had the Paycheck Protection Program. And so the Provider Relief Fund spent $122 billion in 2020, or that's how much that was spent, or that cost. The Paycheck Protection Program was $53 billion in 2020. And then, of course, we also had the increased federal public health spending, and that was a whopping $114.9 billion. And in that, you have to include the spending for the vaccine development, all the COVID-19 testing that was done, that was covered, that you didn't have to pay for. Somebody had to pay for it. And the health facility preparedness to deal with the pandemic. So just kind of as a fun tidbit, where did this provider relief fund money go to? So general grants to providers based on 2% revenue, so that they've given to hospitals to deal with, hospitals and providers to deal with the pandemic. We have a chunk to skilled nursing facilities, vaccine development and therapeutic development. Some went to rural providers, safety net hospitals, reimbursement for uninsured COVID-19 patients, high COVID-19 hospitals, and some of it was still unallocated as of December 2021. So this is a graphic from the Kaiser Family Foundation. So when spending for federal public health and other federal programs, which includes COVID-19 supplemental funding, is removed from the analytics, from the spending algorithms, then really the healthcare spending growth was only 1.9%, which was a slower rate of growth from the 4.3% increase that happened in 2019. But again, it's double whammy. A lot of the money, if you throw out all the pandemic spending, well, a lot of the spending had gone towards the pandemic spending, but people weren't doing elective procedures. They weren't going to their doctors. There was a lot of things that wasn't happening during the pandemic too. So yeah, we largely had a reduced use of medical care goods and services because everybody was quarantined at home, or just elected not to go to the clinics or the hospital to not be exposed to COVID-19 if it was minor issues. There you go. So in 2020, the health expenditures for hospital care, they increased 6.4%, or $1.27 billion. So that was a slight increase from 2019. Again, makes sense, accommodating patients that were hospitalized for the pandemic. The physician and clinical services, so this is like doctors' offices and things, grew 5.4% to $809 billion in 2020. Also a slight increase from 2019. And then your prescription drug spending increased 3%, or $809 billion in 2020, which was a decrease from the 4.2% in 2019. So the COVID-19 pandemic had a major impact on national healthcare expenditures because of the increased burden of care by the government. So the government stepped in and helped a lot of the hospitals and the private entities because of the pandemic, really. So in 2020, Medicaid and Medicare spending grew 3.5% and 9% respectively, meaning Medicaid spending grew 3.5%, Medicare spending grew 9%. While private pay and consumer out-of-pocket spending declined about 1.2% and 3.7% respectively. And so, again, some of this decline in spending on the private end is because the pandemic was happening, so individuals opted to not visit the healthcare providers for some of these non-COVID-19 related issues. Maybe they just put off their wellness visit or put off their checkups. And so many hospitals also canceled elective surgeries because there was a too high risk of them coming into the hospital even for an elective surgery and then catching COVID-19 while they were there. Dental services also declined from the previous year for the same reason. Some of the clinics may have been closed, or again, patients weren't willing to go out and interact with the public. In summary, hospital spending accounted for 31% of the overall 2020 healthcare spending, with physicians and clinics representing 20% of the total spending, and your prescription drug spending accounted for about 8% of total health spending in 2020. Your out-of-pocket spending decreased because many insurance companies voluntarily waived cost sharing for COVID-19 treatments. So again, the pandemic kind of scrambled everything, and so we're still, now we're post-pandemic and things are kind of returning back to normal, but our increased spending is still there. So how is healthcare paid for, really? So unlike countries that have universal healthcare systems, in the U.S., payment for healthcare service is derived from 4 main sources. So you have out-of-pocket payments or cost sharing from patients who pay entirely or partially for the services rendered. And we'll address some of these terms and things in the next video. which is going to talk about insurance. But like if you have a copay that you have to pay when you go to see the doctor, mine's $35, so that would be considered an out-of-pocket payment if you have to meet deductibles or things like that. Next are payments from health insurance plans, and this is a really big chunk of healthcare spending, of how things get financed. So those are your indemnity plans or managed care organization plans that are either like that are purchased usually through employer organizations or purchased from the marketplace, the ACA marketplace. Public or governmental funding. So these are programs like Medicare, Medicaid, and other governmental programs. Think TRICARE, VA Hospital, Indian Health Services, etc. And then your health savings account, which are often marketed with your health insurance by your employer. So you often can buy those through your employer. There are some of those also on the health insurance marketplace. And so these health savings account, also known as, there's also consumer-driven health plans, health reimbursement accounts, etc. We're going to look at all of those in an upcoming video. So last slide of our intro, knowledge is power. So as a result of the passage of the Affordable Care Act of 2010, the government has played an initiative-taking role in developing a healthcare system that is more consumer-oriented. So you have more access to information in an easier formats, more understandable. It's easier to see what, even in your what your employer offers if they have different plans. You have to have this clear table that compares so you can make informed choices. The Act is also requiring more employers to offer health insurance benefits and requiring individuals to purchase health insurance if they can afford it from the health insurance marketplaces. The Act also requires health insurance plans to provide more information about their plans to their members so that they can make informed decisions about their health care. So the next video we are going to look at is going to be all about health insurance. So I will see you there.